Great. So today we are discussing all about tetracycline. So tetracyclines are broad-spectrum antibiotics. And a broad-spectrum antibiotic is a powerful medication against bacteria. It can kill many different types of bacteria. So as the name implies, broad-spectrum. So it can kill a wide variety of bacteria. And they are used when you are not really sure exactly which bacteria is causing the infection because they cover a lot of possibilities. But note that it can also harm good bacteria in the body. So it's important that we use it wisely. So this is one important thing that you should know about tetracycline. It is bacteriostatic. Bacteriostatic. So the word is static. So it will stop the bacteria. So anytime you see tetracycline, remember this stop sign. It will stop the bacteria. So instead of killing the bacteria, it will stop it outright. It will cause it to pause and not grow again so that they cannot multiply and cause more trouble in the body. So bacteriostatic antibiotics work by stopping the bacteria from growing and spreading and giving the body time to fight off the infection. I hope you got it. Bacteriostatic. It is stopping the growth of the bacteria. So I guess you may have heard bactericidal. So let's clear that doubt here. As bacteriostatic is preventing the growth, it is stopping it. Bactericidal, cidal means to kill. Cidal means to kill. So if something is bactericidal, what will it do? Can somebody drop it in the comment? If something is bactericidal, what will it do? Bactericidal will kill the bacteria. It will kill the bacteria. So please note the difference. Whenever you see bacteriostatic, you know that it is stopping the growth. And when you see bactericidal, you know that it is killing the bacteria. And what we are discussing today is tetracycline, and tetracycline is bacteriostatic. It will stop the bacteria from growing. So it's important that we know some conditions that we use tetracycline to treat. So tetracycline is used to treat acne vulgaris. Acne vulgaris. Rocky Mountain spotted fever. Amoebiasis. Typhus. Cholera. And is also used to treat syphilis in patients who are allergic to penicillin. You know that we usually give penicillins to clients with syphilis, but in case that client is allergic to penicillin, we're going to give syphilis. It is also used to treat Lyme disease, as well as H. pylori peptic ulcer disease. So kindly take note of the common conditions that we can use tetracycline to treat. So I put this mnemonic here to help you remember the indications for tetracycline. So anytime in your exam, you see a question that you're going to be asked what tetracycline is used for, remember BBC Marvel. BBC Marvel. Remember Marvel, who works at BBC. So BB is Borrelia burgdorferi. Borrelia burgdorferi. It is the bacteria that causes Lyme disease. C for chlamydia. M, mycoplasma pneumonia. A, acne. R, rickettsia. V, Vibrio cholerae. And L, Lyme disease, which is caused by Borrelia burgdorferi. So anytime you are being tested on what tetracycline is being used for, remember BBC and remember Marvel, who works at BBC. So let's look at another interesting use for tetracycline. It is used as a sclerosing agent. A sclerosing agent in pleural effusion and pericardial effusion. So let me explain it further. You have a client who is always coming in with pleural effusion. And you know that pleural effusion is accumulation of fluid in the pleural space. So we can use this tetracycline as a sclerosing agent. It is injected into the pleural space and it will cause inflammation of the area. The area gets sclerosed and it will seal up so that the fluid will not keep recollecting there. So tetracycline can be used as a sclerosing agent in pleural effusion and in pericardial effusion. So in pericardial effusion, it will be injected into the pericardial space. It will cause inflammation, fibrosis, then the area will seal off so that the fluid will not continue to accumulate there. So I hope you got it. If you got it, let me get your feedback. I really love to get your feedback to know that you are following. If you are following and it's making sense, drop your yes, yes, yes in the chat box and let me know that you are rolling along with me. Yes, thank you so much, Preet. Thank you so much, Mikhail. Thank you, Ramandeep. That's great. So let's move on. So this is another interesting use of tetracycline that I want you to know. It is used in the management of SIADH. Have you heard SIADH before? Syndrome of inappropriate ADH secretion, that is antidiuretic hormone secretion. So let's dive a bit into SIADH. So when a client has SIADH, picture a client who is soaked in water. So the client, anytime you see SIADH, remember, I can't pee. I can't pee. The client cannot void, cannot urinate. So because the client cannot pee, the client is soaked in water. So the client has ballooned up in water. But one interesting thing is that tetracycline will cause you to pee more. So for the client who cannot pee, we give tetracycline, and that type is demicycline, and it helps the clients to now pee. Demiclocycline. It helps the clients to pee because the side effect of demiclocycline is that it will help you to pee more. So if you have a client with SIADH who cannot urinate, then we can use that feature of tetracycline, which is inhibiting ADH hormone production, to help the client to pee. So that is why tetracycline is used in the management of syndrome of inappropriate ADH hormone production. And the type of tetracycline used is called demiclocycline. You got it? Demiclocycline. So at this point, I would want us to do a quick recap. Can somebody give us in the chat box, or you can unmute and speak and let us know some of the indications of tetracycline. So how would you pick up a medication which is a tetracycline? So when you have a list of medications given to you and you're wondering which of these medications fall under the tetracycline group of antibiotics, this is the trick. Look out for the suffix, that is the ending of cycline. Cycline as the ending of the drug name. So let's now look at some examples. I already told you about this first one, demiclocycline. Demiclocycline, which is used to treat SIADH. We also have doxycycline. So you see they are all ending in cycline. Minocycline, tetracycline, tigercycline. So they all end in cycline. So these are some examples of tetracycline. So in which forms do tetracycline come? We can have it as topical. You remember from the acronym, we use it to treat acne. So we can have topical tetracycline creams used to treat acne. We can have it in ophthalmic solution. So I guess you may have heard of tetracycline ointment, eye ointment, tetracycline eye drops, and we can have it in oral forms as well. So take note of that. So when should tetracyclines be administered? You have a client who has been given tetracycline. When should you administer tetracycline? Tetracycline is given on empty stomach. It's given on empty stomach 1 hour before meals and 2 hours after meals. 1 hour before meals or 2 hours after meals. And remember that we're giving it with a full glass of water. So what is the effect of food and milk on tetracycline absorption? Because we're saying that we would not want to give it at the time that the client is eating. It's because food and milk products will decrease the absorption of tetracyclines by half. So if you are giving it with food, it means that tetracycline is not going to be able to work well. So avoid giving tetracyclines with food and with milk products. I hope you got it. And let's take note of this as well. What do you do when you are applying tetracycline to the skin? We learned that you can have tetracycline in the topical form. So before we use it on the skin, the area has to be cleaned with soap and water, and we make sure that we rinse the area well before application of the topical tetracycline. And let's look at another important point that you should know about tetracycline. It binds to calcium. It binds to calcium. So when you see in a question that the client is on calcium tablets and now is going to be given tetracycline, you must take note because the calcium will bind to the tetracycline and prevent it from doing its work. And note that tetracycline can slow the rate of bone growth. And tetracyclines can also cause yellow-brown tooth discoloration. So it can bind to calcium. Tetracycline can slow the growth of bone. And then tetracycline can also cause tooth discoloration. So who would you not give tetracyclines? This is a very important NCLEX tip, and pay close attention to this. Tetracycline is contraindicated in children under age 8. We just said that tetracycline will slow bone growth. So when you're giving it to a child under 8, tetracycline is going to slow the bone growth and is also going to stain the child's teeth and produce yellow-brown teeth discoloration. So that is why we are not going to give the child under 8 tetracyclines. We also will not give it to a pregnant woman because it can affect the fetus. It's going to affect the bone growth of the fetus, and later in life, it can also stain the teeth of the fetus. So we are not going to give it to that pregnant woman because it has an effect on the fetus, the teeth as well as the bone. Lactating woman. We are not going to give it to a lactating woman because as she breastfeeds, the baby would also have tetracycline and might end up having teeth discoloration as well as slow bone growth. So can we put in the chat box the 3 groups of people that we are not going to give tetracycline. I would want to know that you were following. So now we're going to look at some common side effects of tetracycline. They include nausea, vomiting, diarrhea, abdominal cramping, and flatulence. Also, tetracycline causes phototoxicity. So the skin becomes sensitive to sunlight and the client can have sunburns. Rash, dizziness, dry mouth, bulky or loose stools. And then for those used topically, the client can have local burning and stinging. So take note of these common side effects of tetracycline. Tetracycline also has some serious side effects that you must know. Anaphylaxis, it can cause allergic reactions. Superinfections, so it causes other infections to come in. Hepatotoxicity, it means that it harms the liver. It is toxic to the liver. It also causes exfoliative dermatitis. That is a very serious skin inflammation. And as we have said earlier, it causes permanent tooth discoloration in children. Permanent tooth discoloration in children. And remember that in clients with underlying kidney disease, it can affect the liver and it can affect the kidneys as well. So tetracycline can be toxic to the liver and toxic to the kidneys. So we'd want to avoid using tetracycline in a client with kidney impairment. So take note of this important NCLEX tip. So I would want you to also be able to remember the side effects of tetracycline forever. So we are using this mnemonic, carpal dev. Carpal dev. So keep this in mind. Anytime you see a question and you are being tested on the side effects of tetracycline in that scenario, remember carpal dev. So K, as I mentioned earlier, kidney. So kidney failure. A, anti-metabolic effect. P, photosensitivity. We talked about the fact that the skin will become sensitive to sunlight and clients can have sunburns. I, insipidus. You remember I mentioned that it is used to treat SIADH. In diabetes insipidus, client is what? Peeing more. Peeing more. So that is why it is used in SIADH, because in that condition, the client cannot pee and is soaking in water. So we use this side effect insipidus, that is peeing more, to help treat the client with SIADH. Liver toxicity for L, D, dentition and bone defect. E, expired drugs can cause Fanconi syndrome. So Fanconi syndrome is a reversible kidney injury. And when clients are given expired tetracyclines, they can have reversible kidney injury. And that is called Fanconi syndrome. And V for vestibular dysfunction. So take note of carpal dev, which is for side effects of tetracycline. So let's move into another important part of tetracycline, your nursing assessment of a patient with tetracycline. Assess for history of renal or liver problems. So can somebody put in the chat box? And in your assessment, we should also monitor the inputs and the output. We want to make sure that the client is adequately hydrated. So this is an important NCLEX tip. Report these side effects to the prescribing practitioner, especially client who is having diarrhea, because they can lose a lot of fluid and become dehydrated. Or the client who tells you that I'm having difficulty swallowing. So you gave a client tetracycline and it's been for some days and client is complaining, I'm having difficulty swallowing. You have to pay close attention to this and report to the prescribing practitioner, because tetracycline can cause inflammation of the esophagus. So if the client is complaining that I'm having difficulty swallowing, it may be due to esophagitis. Esophagitis is inflammation of the esophagus. So pay close attention to this. So after your client has been given tetracycline, what are you going to tell them? So we've given this client tetracycline for some days. Your client is being discharged. What education are you going to give to this patient? Number one, clients should avoid exposure to direct sunlight. Tetracycline is going to cause photosensitivity. It's going to make the skin sensitive to sunlight. So if the client is going to walk around in the sun for hours, then the client will be prone to getting sunburns. So clients should avoid direct sunlight, should avoid UV light, and should avoid tanning beds. Why? Because tetracycline causes phototoxicity. It makes the skin photosensitive. So this is very important, and do not miss this anywhere in your NCLEX questions. So what should clients wear then when they are going out? They should wear hats, long sleeve or long-legged clothing to cover the exposed parts of the body, and then sunglasses when they are outside, during and for a few days after treatment. So this is something too that you should know about topical tetracyclines. The topical form can stain the clothing. So we can also let the client know about this. So let's talk about these quick points, which will be needed in your NCLEX exam. We've spoken about it, but I'm going to emphasize that again. Oral calcium salt will reduce the absorption of tetracycline hydrochloride. So if a client is on calcium tablets and you're going to give tetracycline, remember that it's going to bind to the tetracycline and prevent it from doing its work. Aluminium hydroxide found in antacids will also reduce the effect of tetracycline. It will bind to the tetracycline and prevent it from working effectively. And as we also said, we are not going to give it with dairy products because it will bind to tetracycline and prevent it from working. And yes, this point is very important. If you have to give tetracycline to a female teenager for acne, you should find out whether the female is sexually active or on any contraception. Because what if the client is pregnant and then the client is going to be given tetracycline? So we have to find out whether the client is sexually active or the client is on any contraception. So remember this key point. And remember this as well. In the indications for tetracycline, we spoke about tetracycline being used in H. pylori treatment. So tetracycline is part of the quadruple therapy for H. pylori. So we have esomeprazole, metronidazole, then tetracycline is added, and we also add bismuth subsalicylate. So tetracycline is used in treating H. pylori. So when you see that question anywhere, you should be able to answer. And we have said this over and over again. Do not give tetracyclines to a pregnant woman. It will cause tooth discoloration in the fetus, and it will impair bone mineralization. So yes, we are ready to try some questions. So that we test ourselves to be sure that we have gotten the content. I'll be very grateful if somebody would volunteer to read the first question. You can unmute, read, and then we answer. Even if you do not want to choose the answer, you can read and you will choose the answers.
Okay, Ramsey.
Okay.
Yeah, let me read the question.
Okay.
What should a nurse expect a client to require in order for tetracycline to work effectively? Option A, a strong immune system. Option B, taking iron at the same time. Option C, extra pyridoxine HCI, that's vitamin B6. And D, regular checks on blood count every week.
Great. Thank you so much for helping us out with the question. So what will be the answer? What's the answer? Do I have any answer in the chat box? We have D, complete, regular checks on blood count every week. No, no, no. We've got D again by Velen. A by Mikhail. Yes, the answer is A.
Yeah, the same thing I'm thinking.
Yes, great. The answer is A, a strong immune system. So let's get to understand why. Remember, we discussed that tetracycline is a bacteriostatic agent. So it will cause the bacteria to stop. And then is relying on the body's defenses to now complete the process to fully eliminate the bacteria. So that is why a strong immune system is very important. So it's important to administer iron, antacid, laxatives, food, and dairy products either 1 hour before or 2 hours after taking tetracycline to avoid interference with absorption. And then for vitamin B6 supplementation is recommended with isoniazid use, not with tetracycline. And then for the last option, regular weekly monitoring of the complete blood count is not required because it's not causing any changes in the profile, the complete blood count profile. Great, thank you so much. We move to the next question, but before that, note this, that the core issue of the question is the mechanism of action of tetracycline. So if you know the mechanism and how it leads to eradication of infection, you should be able to answer this. So let's move to the next question, and who would volunteer and help us run through it quickly?
Okay, let me go ahead.
Sure, Randy.
Okay, for which patient would tetracycline be suitable?
Great.
A breastfeeding 22-year-old female. B, a pregnant 32-year-old female. C, a 58-year-old female with 6 children. D, a pregnant 7-year-old female.
All right, so what's the answer here? So we have to apply the indications and then the contraindications, clients that you will not give tetracycline. Okay, C. Prayer gave us C, Mikhail C, Ramandeep C, Prince C. Great. You got it. You got it.
The answer is C.
Yes, you got it. I'm so excited. You all got it. Because you know that it is contraindicated in children under 8 years. So it makes option D wrong. And we also know that it's contraindicated in pregnant and breastfeeding patients. So A and B will surely be out. Great. Well done. You are getting the content. Next question. Who will help us with reading, please?
You're about to assess a client. She tells you, the doctor prescribed minocycline for my acne. I now have sunburns easily. What should you tell her? A,
Great.
there is nothing wrong with you. B, drink more water. If it continues, go to the nearest emergency room. C, we need to do some blood work, including your kidney function test. D, you will need sun protection since the medication can be phototoxic.
All right, so what will be the answer here?
Z.
D, 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 D. Great, 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 great. D, great. Yes, yes, yes. The answer is D, and you all got it correct. Good job. Let's look at the teaching point. We should always remember that tetracyclines are phototoxic, so clients must have a means to protect themselves. So they should avoid exposure to direct sunlight. So well done, well done. Next question, who can help us with this?
You are the nurse about to administer doxycycline to a client with a bad lung infection. Which labs on the patient's chart should prompt you to hold on with the medication administration and talk to the prescribing doctor? A, decreased hemoglobin level. B, high creatinine and urea level with decreased eGFR. C, high platelet count. D, high neutrophil count.
Great, thank you so much. So what's the answer for this question? B, B, B. I'm getting B's. Randy, Pret, Ramandeep, Mikhail, Velin, B. Great job. You all got it correct. Well done. B. The answer is B. Yes, and you should remember, as we discussed, that tetracycline will cause further kidney damage. So with B, the client has high creatinine and urea levels with decreased filtration rate, which means that there is decreased kidney function. So you are not going to add on tetracycline, which will affect the kidneys. Great job. So avoid tetracyclines in clients with kidney damage. So let's take a look at this question. Who will help us take it?
Okay, let me read.
Okay, thank you.
Among these patients, who is tetracycline contraindicated in because of its ability to bind to tissues in the body which are undergoing mineralization?
Okay.
Option A 14-year-old girl who is not sexually active. B, a patient with end-stage renal disease who is undergoing dialysis weekly. The third option, a 65-year-old male with root canal surgery and some implants in the teeth. The last option, a 5-year-old healthy boy who recently had an infection.
So what will be the answer? Can you all help here? Waiting for your answers. Gotten the first D from Randy, B from Velin. So you have to remember the contraindications in case the cases that you would not give tetracycline. Mikhail says C. The answer is D. A 5-year-old healthy boy who recently had an infection. We do not give it in children under 8 years because it's going to affect their bone growth and bone mineralization. So that is the teaching point here. So among the 4 clients that were listed, the 5-year-old boy is the one who is growing and the body is undergoing a lot of bone mineralization. And remember, we also said that it can cause permanent tooth discoloration. So we are not going to give it in that 5-year-old boy. It can also cause stunted growth. So let's take a look at the next question. Who's going to help us with this?
You overhear a colleague of yours educating a client who has been prescribed doxycycline for a pneumonia. What should the plan include? A, take medication on a full stomach. B, milk will help with absorption of the medication. C, client should wear white brim hat, long sleeves, and use a sunblock to help with absorption. D, do not take doxycycline with milk.
So let the answers flow because you got the content. D. Great. D. Great. Well done. The answer is D. And as we already said, absorption will be delayed when you take it with milk. So we're going to educate that client on the tetracycline not to take it with milk. That is awesome. So let's take the next question. Who's going to help us to do the reading one more time?
Which of the following conditions is a tetracycline not indicated?
So the answers are coming in already. A. That is great. So remember that it is used in treating acne, Rocky Mountain spotted fever. It is also used in treating typhus. So the answer is dental abscess. So remember this mnemonic, BBC Marvel. I hope you remember it. It will help you to remember the indications for tetracycline. So let's take the last question. Who's going to read this question for us? The last question. Let's finish up with this question.
Okay, let me read. A 28-year-old woman is in for contraception advice. You will ever note that she is taking tetracycline as part of the quadruple therapy for H. pylori eradication. What is your next best step? Option A, give the oral contraceptive pill to the client. Option B, switch a contraception form to an implant. Option C, notify the doctor who prescribed the oral contraception. Again, option D, tell the client to stop the medication right away.
All right, so what will be the best choice? So I have B. I need more answers. B, I'm only getting B. I've got C from Prince. Okay, C from Randy. B from Prince. B from Yetunde. Okay, let's take a look. So the answer is C. Notify the doctor who prescribed the oral contraception. And let's get the teaching point here. Remember that offering oral, the other contraceptive, or changing what's been prescribed is not within our scope as nurses. It's not within your scope as a nurse. So contacting the prescribing physician is the more appropriate step to take. So that was what was being tested in this question. You should know your scope as a nurse. So you would have to contact the prescribing physician. You would not want to change the pills. So let's take a look at this. Oral contraceptive or birth control pills contain estrogens. The one containing estrogen may not work properly if you take them while you are taking tetracycline. So the client is already on tetracycline. We would have to inform their prescribing physician. And in some cases, doxycycline may be preferred because research has shown that it doesn't stop any type of contraception from working. Either is a combined contraceptive pill, progestogen only pill, or emergency contraception. But the key point that was being tested here is that it is not within your scope. Contact the prescribing physician. Great. So let's run through quickly some teaching points about antibiotics that a nurse should focus on. You should know the drug. You should know the dose. You should know the purpose, why it's been given. You should know the route, and you should know the schedule. And clients to take the drug at evenly spaced intervals without disrupting sleep to maintain serum levels. And note, some antibiotics will be taken with food if it's not contraindicated to minimize GI upset. But we have to discuss that for tetracyclines, they must not be taken with food. And we should ensure that there's adequate fluid intake, 2,000 to 3,000 ml fluid intake daily. If it's not contraindicated, if the client doesn't have any fluid overload, heart failure, kidney disease, or any other condition, adequate hydration is relevant. And if we are using the liquid preparation of the antibiotic, use the calibrated measuring device. So these are important key points. And remember this again, you should not forget this. Avoid tetracycline in pregnancy. Children under 8 years, avoid. And if patients have to take tetracyclines, avoid foods that contain calcium, iron, magnesium, because they are going to bind to the tetracycline and prevent it from working effectively. So yes, let's nail down all that we have heard today with this tetracycline story. And with this, I'm hoping that you'll be able to ace every question that you ever see in your NCLEX on tetracycline. So as the name is tetracycline, it has cycle in it. So when you see tetracycline, remember this bicycle, this red and black bicycle. So there's a story of this boy who got a new bicycle because he wanted to go out there and enjoy some time out on his bicycle. But because he was a newbie, the mom bought a bicycle which had these spare tires. So it had 4 tires. So remember, 4 cycles. So tetracycline. Tetra means 4. So this bicycle is representing tetracycline. And since he was a newbie on the bike, he fell and got dirty on his arms, everywhere. And immediately he got home, the mom said, no, you are too dirty. You cannot touch anything. Come right here. Let me give you some sanitizer. So immediately you see the sanitizer. Remember, antibiotic is going to kill the bacteria. So for tetracycline, remember that it is an antibiotic. And today we learned that it will not kill bacteria, but it's rather bacteriostatic. It will stop the bacteria from growing. And when he came in, he was complaining that he had some tummy upset while he was riding. So the mom brought some Tums, that is antacid, and immediately the boy saw the antacid. He said, no, I'm not going to take it. So remember that when the client is taking tetracycline, no, we cannot give those antacids because it's going to bind to the antacid and prevent tetracycline from working effectively. And while out there in the sun, the boy had some sunburns and showed it to the mom. The mom, see, I got some sunburn. So immediately you see the sun. Remember that tetracycline makes the skin photosensitive. So clients would have to prevent the skin from getting exposed to direct sunlight. And yes, mommy said, come in, you are hungry, you've got to take some milk before you take your dinner. Then the boy said, no, mommy, I'm not going to take the milk. So remember, when client is on tetracycline, no milk. And when the boy was speaking, the mom realized that there was so much dirt around the teeth. It was so brown. He said, why do you have your teeth appearing so brown? He said, mommy, when I fell, I got my mouth and my face all on the ground. So I got some sand staining my teeth. So remember that tetracycline will cause permanent discoloration of the tooth. So mom said, why did you even fall? I'm trying to understand because your bike has 4 tires. It's stable enough. I said, mom, I saw some tarantula. It was so scary and it caused me to trip and I fell off the bike. So when you see tarantula, it's so scary. Remember teratogenic. Remember toxic. Tetracycline is toxic to the baby. Teratogenic, it is toxic to the baby and it can cause tooth discoloration and it will affect the bone growth. So anytime you see a tetracycline question, remember this slide, and I guess it's going to help you to be able to pick all the right questions and ace your NCLEX exam. So I guess this session has been extremely fruitful and helpful to you. Can I get your feedback in the chat box how this session has been for you? What are your takeaway or take-home points? Has it been helpful? Will it help you to be able to ace every question on tetracycline? Let me get your feedback. Your feedback means so much to me.